am a peer specialist with Advocates in Action, Rhode Island, and here is the Disability Community Forum. And today we're going to discuss some updates, and I personally hope that we're able to, hopefully my being here as an individual who receives services will help encourage other individuals with disabilities who receive services to speak up too. So right now, hold your questions until the end. Attendees are muted and will be unmuted at the end when we have questions. And here I am going to hand this over to Kevin Savage.
Thanks, Kelly. I appreciate that. I'd like to thank everybody who's on the call for joining and taking time out of what is clearly a busy and hectic time for everybody. And we appreciate you getting on the call. We're thrilled with the response. We had close to, if not more than 100 people request to be on the call. And I just wanted to thank you for participating. I think this is really encouraging. We looked at your questions, a number of the questions that were sent in, and tried to adjust the agenda to answer as many questions as possible. But I do want to tell you that I'm sure there are a number of people who had questions that didn't get sent in. So my goal is to go through the agenda pretty quickly so that what we can spend most of the meeting doing is answering any questions that you have that you may send in through chat. They'll be monitored and open up the room, so to speak, for people to be able to ask questions as a majority of the time that we spend together today. So that's what we want to do so that we really take this opportunity to hear from people in the community so that we make sure that this is your time and not just my time to be talking. I did want to start though by introducing the team, the state team. So today we have with us Heather Mincy, who's the Assistant Director for Developmental Disabilities, Brenda Duhamel, who works on our team, functioning a lot of our projects, overseeing and seeing through a lot of the projects on the team. Unfortunately, Tracy Cunningham is not able to join us, but Jay McKay is here in her place. Anne LeClaire is here, and Susan Hayward. So, and Susan works on our transitions, and Anne works in a number of areas related to some consent decree work, and does a lot of our work in terms of communication and on the Therap project, which is our database. So we'll get started. So I wanted to start with our updates. And of course, COVID is a lot of the work that we're focusing on now and making sure that we're working as much as possible with our agency providers and people in the community. But I wanted to give you some statistics. So it's no secret, you're hearing on the news what the COVID impact is, particularly as things have been heating up in the last several weeks. Right now, of the 291 sites that we have that are providing residential services, 31 are currently impacted. And in the last 14 days, 63 staff members and 33 residents have been impacted by COVID. So they're currently showing no hospitalizations, but I believe that that's just because the data at the Department of Health is tracking a few days behind what's being reported. So if anyone has questions on that, just hold your questions and we can certainly get to more specific data if people have more data questions. But I thought that's probably what you want to know for what's going on, what's happening right now. So I'll leave the data to that. Another update we got out last Friday was on updating visitation guidance. So there had been some relaxation in visitation standards for residential care, but we sent out on Friday a pullback on visitation and very, very strongly advising the congregate care providers across our system to suspend all visitation other than for very specific compassionate care visits. And I know this is really a hard time as the holidays are coming up. But because of the outbreak, the number of staff and residents who are being impacted, we thought that that was the best course of action to take. So we began implementing that right away. And we needed to move in that very, very quickly to keep this vulnerable population as safe as possible as things are heating up with the spread of COVID currently. And again, if you have questions, we can certainly talk about that as we get through the agenda. Some other updates that I'll give you is, I just wanted to acknowledge the concerns about what the impact is for long-term quarantining and social distancing for people particularly in residential facilities, but also on people who are self-directing or otherwise living at home, that this can be a really lonely time. So I would encourage you to work with your loved ones or yourselves if you are a person with a disability and you're on the call, to read bulletins that we put out regarding positive mental health activities that you can engage in. Some providers are doing virtual activities, so I would encourage you to participate in those so that you do get some kind of access to community supports. If you feel that you're not getting the kind of support that you need and you need to engage in another referral or work with another agency, please feel free to call your social caseworker and seek out information on another kind of referral or referral to an agency who can provide group activities online. We're working with Medicaid to verify that group activities can be billed to Medicaid, so there's been some lack of clarity and we're working to resolve that. But please feel free to ask any questions you need to on how you can get the services or your family members can get services that you need to be supported as we get through these winter months, which we're anticipating will be very difficult ones. We're working on CIS, and we'll talk a little bit more about that later, but we've gotten the CIS workers recertified, so that's been completed, and we're getting the CIS meeting scheduled on a secure Zoom line, a HIPAA compliant Zoom line. There are 241 CIS meetings that need to be scheduled, and the scheduling is underway, and so we'll be getting that done. I know that plan writing is also happening on Zoom lines, so I would just encourage people to remember that as you're accessing Zoom lines, just to be mindful of privacy conversations and to really do your best to make sure that if you can, to use compliant HIPAA lines so that your calls aren't being, that you're not using or engaging in HIPAA related calls that aren't on lines that aren't secure. So try to be very, very careful about that. There was a question about keeping day programs afloat and preventing them from shutting down. And so we don't certainly want to lose any services during this pandemic. We know that services are extremely important to all people with disabilities and certainly to their families to make sure that they have access. We're strongly focusing on community-based program, and that will be our focus not only now during this pandemic, but also going forward, that we want to see that people have access to services where they need them and in ways that are much more individualized than they've been in the past. So we're going to continue to focus on community-based support and community-based programming to meet consumer needs going forward. The pandemic has changed many ways that individuals might be utilizing their allocation for day fund supports. So if you have unused day fund supports and are interested in using them differently, such as to purchase technology or equipment, or hiring staff, or changing services, or joining a gym class, please reach out to your provider agency, fiscal intermediary, or your social caseworker for support in how to go about using your funds in ways that you haven't been before. There are flyers available that you can read that will help you figure out how to access those resources. Recently, the department approved supporting SLA providers to receive day support funding for providing services, day support services to individuals living in their homes. And so we're working on operationalizing that support. So in the same way that we've worked with family members, which is a new policy during the pandemic, to access day support funding for their adult child with a developmental disability. We're doing the same thing to help support SLA members who in the past would have access to day programming outside the home. Since they're providing them the support inside the home, we're working to actually fund that support as well. We have a new initiative called START, capital all caps START, which is an evidence-based model that includes intensive training and certification of individuals as quote unquote START coordinators. And the Center for START Services will work with Rhode Island to develop a crisis intervention system for individuals with intellectual developmental disabilities that also have behavioral health needs. And the START coordinators provide crisis prevention and intervention services. Leadership in the department and around the state are very excited and on board. Funding is secured and a contract with the Center for START Services is in the works, so that we'll be getting that up and running. And we're excited because it works to train people in the behavioral health and mental health communities to specifically work to meet the needs of people with IDD. So that's very exciting. We want to talk about EVV, electronic employment verification, and I'm going to ask Heather. She's our resident expert on EVV, so she's going to give a brief update.
So EVV is the electronic visit verification system that individuals who self-direct their services and need full assistance for some of the services that they're getting would have to do, basically. So where we're at with this right now is EVV is set to be implemented with a January 1st of 2021 start date. It's kind of a soft launch because we're still working with the FIs and all the stakeholders to get people on board and people up to speed as to what needs to be done. So there are groups that are going on that are meeting to discuss some of these things. We just recently were working towards trying to figure out within our system of those, who are using the self-directed model, how many people would be subject to EVV. And we have, out of the 5 FIs, 4 have responded so far. And we do know that there's, through these 4 FIs, 37 individuals that will be subject to EVV. So it's not a lot of people within our system, but for those people who will be affected, we definitely want to make sure that they understand what it is and what they're doing and how to use this system. So there's, again, just work that's being done behind the scenes on that. We're also going to be putting out very soon a one pager on information regarding what EVV is and who would be subject to it. And that's pretty much it, Kevin.
Yep, thanks, Heather. Yep. And Jay McKay is going to give an update on PCEP 3.
Thanks, Kevin. Just to give you an update on what Tracy and I have been up to, PCEP 3 is well underway, which is the Person-Centered Supported Employment Performance Program. We've got 4 projects that are working with us, Looking Upwards, Perspectives, 7 Hills, and Work Inc. The PCEP 3 was designed around consent decree individuals who are part of the protected class. So that'll be youth exit, shelter workshop, and day, and individuals who have never been employed. So if people are interested in finding out more about this program, there is a flyer on the DD employment website section. There is also, as part of that flyer, there are some links. There's PowerPoint presentations from all 4 projects that you can look into. And there is also, thank Advocates in Action. We had done a virtual house of all the programs. So there is a recording link that you can also check out and get some more information. If you're not sure whether you're eligible for this program, you can contact myself or your social caseworker so we can let you know about that. And if PSEP3 is not something for you, then there are other employment programs that are still going on. Even through COVID, we have many heroes that continue to work as essential workers. We have some individuals that have been furloughed, and we've had actually many job hires since March as well too. So a lot of good things going on in the employment. Another thing that had happened last month is we had Real Talk about employment, which was hosted by Ripen. We had a peer-to-peer group, and we also had a family-to-family group. That was on October 22nd and 29th. So they talked about their experiences and answered questions about those who are still hesitant about employment. So we will probably be doing a couple more of those sessions. So stay tuned for more information. And that's all I have for employment.
Great. Thank you, Jay. Nice. So I actually gave this update. I don't have anything else to add on that. So I'm going to go to the consent decree. So under the consent decree, the court had issued an order identifying 16 administrative barriers that the department was, I'll say asked, but actually ordered to work on to relieve the burden that particularly providers need to use resources that distract them from providing the resources to people with disabilities, and instead use those resources to meet administrative requirements in a number of areas. And so what we did was we combined the 16 administrative issues into 5 work groups to try to address how we can relieve those administrative burdens so that resources can be freed up to provide the services to people and the resources where they're needed to provide services to people with disabilities. And so the 5 work groups are dealing with the barriers that are related to fiscal concerns, eligibility, appeals. So when people want to appeal funding or a decision made by the department, contracts, and that by contracts, it's how a person sets up from their ISP to how they actually get their services met by a provider. So they're basically their PO plus their ISP is what we call the contract. And then individual budgets, how someone's individual budget is managed between them and either the provider or the FI. And so those work groups, they've been meeting every week. There's some subgroups and work groups as well to try to get to the bottom of what we can do to relieve all the fiscal issues that families and providers and individuals are working on, and their work kind of gets bogged down on. And we have a responsibility to report to the court every 2 months. We do that. And we've had 2 reports that have gone out so far. We're sort of at a midway point. We're trying to get all of the decisions and recommendations out by the end of the year. Later this week, we have a sort of midpoint meeting where all of the groups are going to get together and discuss where they're at, make sure that we're heading in the same direction, because there's a lot of interaction that happens and overlap that happens among the groups where what decision one group makes is going to impact another group. So we want to make sure that we're not working in a manner that's counterproductive, but we want to be heading in the same direction. And the groups have a good cross-section of representation among stakeholders. We have people with disabilities on the group. We have family members in the group, advocates, obviously members of the state, different state agencies. So BHDDH, EOHHS, Department of Human Services, all providing the information so that the right expertise is there to be able to get decisions made, questions answered, and keep the progress moving forward. So I'm not going to get into the details, although people have questions about the details. I'm certainly willing to do that. I have the last court report here in front of me. But I think the main gist of what I want to get out to this population is that it's important that we recognize that the more we're bogging you down with administrative burdens, the more we're distracting and detracting from people being able to provide services to the people who need them. And that's what we want to address. So that's really the main issue with the work groups. That's really all I had on where we are with the consent decree. We're working hard. We have a great group of people working together. I think it's significant amount of cooperation between the three agencies involved, ORS, RIDE, Rhode Island Department of Education, BHDDH. We work extremely well with the court monitor, and we've had excellent leadership. Brian Goslin has been leading the team and for the past, I would say, year. And I'll just ask Brian if he has anything that he would like to add at this point.
Good afternoon. Nothing in addition to add, Kevin. I know that there's been a ton of work out there and new reports from the monitor that are really outlining the pathway for the next 3 years to the end of the consent decree 2024, which is what we are all aiming towards, making sure that the system is in compliance with what the court has ordered, but also it is centered around the person, which has been the main intent of all of the work around integrated day employment services in particular. So I talk to many of you on a regular basis and appreciate all the support in my interim role as the consent decree coordinator for actually almost 2 years at this point, believe it or not. And we're looking forward to providing some additional resources to the consent decree as we move forward. So nothing in addition to add, but always here for any questions or outreach that the community or providers have. So thank you so much.
Great. Thanks, Brian. So the next issue is conflict-free case management. A working subgroup of the Quality Advisory Committee, which meets monthly. The Quality Advisory Committee meets monthly, but the subgroup, I actually don't know how often it meets, has been charged with developing a recommendation for a conflict-free case management model. And the group is fleshing out details for each federally required component of case management to include a purpose, set of expected activities and tasks, and provider standards. A timeline of 8 weeks has been established to complete the task. So I'm going to guess they meet every week. But Brenda Duhamel is here. Did you have anything you wanted to add to that, Brenda? Brenda leads the charge on this. So I wanted to just let her add anything she wants.
Sure. Hi, can everyone hear me okay?
Yeah.
Yeah, so that's spot on. We're working in a small work group. We then will present to the Quality Advisory Committee. And we're also working with a group from OHHS that works sort of looking at the system for all the folks on long-term services and supports, and to see how conflict-free case management could work across the entire system. So we're in a couple of work groups to go through those things and to see what makes sense. We're hoping to have some product by the end of this year to present.
Okay, thanks, Brenda. There were some questions about technology, and so we had some funding from technology and to help people to purchase technology from the previous fiscal year, and we moved that money forward to this fiscal year. Oh, actually, that's a different issue, so I'm going to say that wrong. But there is funding available, sorry, for helping people purchase technology. And there's a request to itemize what services such as technology can be purchased. So we are working to get that kind of information out to people, but I did want to remind people that in a system where we're trying to make things and working to make things individualized, there's really no exhaustive list, because we always want to be able to consider individualized and individual requests and work with Medicaid on how to fund those requests. So I appreciate the question on, can we get a list out? I think we can get a list out that refers to types of things we can buy and specific things we can purchase. But when an individual has a question, I want people to really think in a way that identifies, this is what I need, and can we talk about that, rather than just going down a list and saying, it's not on the list, therefore we can't do it. Let's keep the conversations about the needs of people very, very open, rather than just referring to lists. So we'll get it out because I think that is important, but keep the conversation expansive. And we certainly are. This pandemic has exposed, I think, very clearly the need to use technology and to make technology as available as possible to people out in the community, and to keep particularly visitation so that people have a way of visiting people when person-to-person visits can't happen. We also want to be sensitive to the fact that not everybody can use technology. So we want to make sure that we're addressing what to do when people aren't able to use technology and not merely rely on technology. So we want to keep also that conversation very expansive so that we're meeting everybody's needs. The last section I think that I had was on budget and funding. So I think I'm probably going to defer a lot of that conversation to the next community forum because we don't have a lot of answers on the budget yet. So some of the questions are anticipated funding cuts. We don't know what's coming. So we don't have a budget that's been approved yet. So I'd rather wait until we have a specific and approved budget before we get into speculative conversations about the budget. So if you have questions, I'll take specific questions and see what we can answer. But at this point, I think that I'm going to delay the conversation on the budget until we have something more specific and concrete to work on. And then I'm going to turn over the conversation to Sue to talk about progress on transition services.
Sure, thanks, Kevin. What happened was we had received a question about what progress has been made in improving the DD system from transition services and beyond. So what I'll be sharing with you is some things that are already in existence, but also some things that are new since the last community forum. So one of the things that we've been doing for quite some time is working very closely with the Department of Education, Office of Rehabilitative Services, and Rhode Island Parent Information Network to create an annual collaborative state plan. And that state plan addresses transition planning and services and guides our shared work in multiple areas throughout the year. We also participate in local, regional, and state transition advisory council meetings, and those provide an opportunity for educators, state partners, family advocacy organizations, and adult service providers to share information. We also provide adult service information to students between the ages of 14 and 22 in all public, private, and charter schools throughout Rhode Island through our participation in IEP meetings for students with intellectual and developmental disabilities. The information that we share is also available on our recently updated transition services page. That page was actually updated this morning, I'm happy to say, on our BHDDH website. So all our transition related materials are translated into Spanish. We also have a Spanish phone line monitored through our contract with Rhode Island Parent Information Network. And that page also includes links to state and national organizations that provide information regarding transition. As many of you know, we have an eligibility by 17 policy. We've had that in place for several years now. And that has led to an increase in students eligible for adult services several years prior to exit from school-funded services. So that has actually allowed for improved transition planning with the student, their caregiver, and the IEP team. What we've been able to do is assign DDD social workers to eligible students at least 1 year, but most often 2 years prior to their exit from school-funded services. All our social workers have undergone training specific to transition services, and they're also provided ongoing information and resources for that work. Also, together with the Department of Education and ORS, we provide presentations to over 60 schools annually to introduce adult service options to educators throughout Rhode Island. And that, again, is for educators in public, private, and charter schools. We also, in collaboration with ORS and Department of Education, participate in 3 project search sites, which provide school to work services for students in their last year of schooling. We've also started, this is some of the newer information that I have. We've recently started a transition community of practice with representatives from adult provider agencies with the goal of increasing communication with educators across the state. One of the initial steps has been to collaborate with the Department of Education to hold what we're calling provider chats, which are opportunities for adult service agency staff to communicate directly with educators through facilitated conversations. So through that group, we'll be doing a number of things, some of which include sharing resources and training opportunities. And we anticipate that that group will be meeting quarterly throughout the year. Following really a great deal of input from families, educators, provider agencies, and social service staff, we've created a transition timeline for caregivers. And that timeline provides benchmarks for steps to be taken as students move through the transition process. We've included that timeline as part of the information packet that we share with students and families during the IEP meetings. And that timeline can also now be found on the transition page on our website. And we've also done outreach to children's organizations like the Cedar organizations to reach a younger population and provide information regarding the process of transition and transition services.
Thanks, Sue. I appreciate that. So that's all that I had for our agenda. And I know that there are a number of questions in the chat room. So I think Michelle's going to help.
We have questions in the chat. We have a couple in the question and answers. And there's a couple that looks like possibly from the notes that were sent in ahead of time. There might be a few that we didn't totally hit. So from the question and answers, the first one is,